As the government steps up its effort in ensuring full implementation of the universal health coverage, with the state of healthcare marred with challenges, especially following the rollout of the new health scheme, public servants could soon be forced to seek medical attention from public facilities. This is after members of parliament backed a bill that calls on the government to fast-track the implementation of the universal health coverage, UHC, and make it mandatory for all public officers to seek treatment in public health facilities. Nominated MP Sabina Chege is behind the bill. According to the former Murang'a woman representative, directing public officers to use public hospitals would not only strengthen accountability but also inject much-needed funding into these institutions through the medical insurance cover provided by government agencies.
This House therefore resolves that the government, through the Ministry of Health, implements the Kenya Universal Health Coverage Policy 2020-2030 and introduce a policy on mandatory use of public health care facilities by all civil servants, public officers and state officers who are using medical cover catered for by the government of Kenya. And I want to challenge members of this House, if you fall sick in your constituency, which is this hospital that you can be able to go and be attended to with the care, or will you wait to be airlifted to Nairobi or out of this country? These people who will treat us in private hospitals are the same doctors that we have employed in the public facilities. So we end up that they spend a very few minutes in the public hospitals and they rush to the private hospitals where they can make extra coin.
Dagoretti North lawmaker Beatrice Elache, while decrying the high cost of medication, supported the motion, noting that the issue lies more with perception than competence.
Can we have a culture of appreciating that when I walk there, you can treat me there, without now telling me now to walk into your private entity? Because that's how the private thing thrives. What we have now gone to is, in some places, people believe health is a maximum profitable entity. It's no longer a place where you can say affordable. That's why
Seme MP, who doubles up as the chairperson of the Health Committee, Dr. James Nyikal, stressed the need to restore confidence in public institutions through provision of quality health care.
What we are proposing is that if we force people who hold important offices in this country, people who make decisions on all issues, money, to use the public services, then the public services will be better. But I think the bigger thing is to look at the ethos of the country. Services, education, and health actually reflect what the integrity of the situation of the country and the ethos of the people are. If we really meant it, we don't need this. We just have to say, we all members of parliament, from now on, we are going to use public services as bad as they are.
Public scrutiny is expected to see whether the legislators will lead from the front, most of them synonymous with seeking medical attention at private facilities, if not abroad. This comes amid security concerns in public health facilities, following two gruesome murders reported this year at the country's largest referral facility, Kenyatta National Hospital. The House will continue to deliberate on the Sabina Chege-sponsored bill next week before voting, in a move that could seal the fate of public servants on matters health. Ian Keitani for K24 Evening Edition.